Mackenzie, I don't know if you have any plans to do a rotation back home, but how are you going to go about that? And does the university offer any support?
Yes, I'm working through that now. Scott is the support. Him and a few others formed the electives team. So they've been great and very responsive with my questions. There's a few ways to go back to Canada. There's an AFMC portal, which is like for all international students to come who want to do electives in Canada. So that's pretty structured. There's a few other options, including going through your connections as well, if you do have kind of an elective in mind. But yeah, I'll be going back for at least 4 weeks for my elective over the break. And then hoping to do my selective in Canada as well. So potentially 8 weeks
What are
in
you
Canada.
looking to do what are the rotations going to be in? Do you know?
I want to do forensic pathology. So I'm probably going to be doing pathology for most of it. And then potentially like an ICU or palliative care, something to supplement that. Because I want experience in like almost the hospital in Canada, whereas pathology is usually like in the basement with a microscope. But I want to see what it's like, yeah, to be like a doctor in a hospital in Canada as well.
Amazing. And maybe one other question for you. Is there a rural placement? Have you done it? What was it like?
There is one in fourth year for 4 weeks, rural GP. So I haven't done it yet, but I've heard like only good things. Yeah. Do you have anything on that?
Look, yeah, so it's most of our it depends a little bit on what the student's situation is. A lot of our international students and Canadian students don't necessarily have their own transport. So getting them away somewhere very remote is less likely to happen. So we'll try and keep them sort of within an hour-ish commute of Perth, where you still get that rural general practice family medicine experience, but you can still commute back and forth. Some of our students do want to go to Broome, Kununurra, the remote outback of Western Australia, and we do try and facilitate that as well, but it's on a case-by-case basis that we do it. And I think Mackenzie is going to be one of those rare pathologists who can actually talk to other people. So we're pretty excited about where her career is going to take her long term.